So the face of head and neck cancer is changing. And I've already talked about risk factors such as alcohol and smoking. They're still there, but what we're seeing is the incidence of smoking and alcohol-related head and neck cancers is actually dropping. The one subset in the mucosal cancers that is increasing is the oropharynx. So that's the tonsils and the back of the tongue. And that's being primarily driven by HPV-related SCC, squamous cell cancer. And what we're seeing now is a huge increase in the incidence of HPV-driven cancers. Up to 70% of tonsil and tongue-based cancers are now HPV-related, whereas 30, 40 years ago, that would have been 20%. So we're seeing younger patients come in that group. They tend to be still primarily male, but we are seeing a shift in the gender split in some other subsets of head and neck cancer.
Yeah. So Matt, I want to share with you a case that I had as well, and this is a typical example of what we were just talking about earlier, of this young population group of the young females who are non-smokers, non-drinkers. She was this lovely 21-year-old girl, Sarah, who came in referred by her dentist after having 5 weeks of a non-healing ulcer along her left side of her tongue. Now, initially, the dentist had thought that this was related to a wisdom tooth. And 21-year-olds, yeah, they do have their wisdom teeth coming through, so it is quite a common complaint. But it's the time frame that the ulcer had been there for 5 weeks, that non-healing, that wasn't healing, that really probably should have been picked up earlier. So by the time the patient had been seen in our clinic, she had a couple of lymph nodes that were enlarged on that level 2 region, which was concerning. And looking inside the mouth, there was quite a large ulcer that was not like just from a tooth bite. It was quite cratered. And when you put your finger to get that tactile feedback, it was hard. And that's probably one key point that I think should be highlighted to dentists, general practitioners, is that hard things, indurated things, are not usually benign conditions.
I think what we could do more is the early detection or attempt to detect early for head and neck cancer. Don't assume the patient, don't assume that you know what's happening, because I was 35, fit and well with no history, and I had tongue cancer. So I think there's no harm in acting early, referring to a specialist or ordering a scan early. If the worst of it is that the patient had a scan and everything's okay, then that's okay. It's much better to find out early. I found out with my cancer that if I had left it only 2 weeks later, they thought that it probably would have spread to my lymph nodes and then to the rest of my body. So I was very lucky that that GP, the bulk billing GP, who I can't even remember the name of, referred me to that oral surgeon, which saved me, really.
It's important for GPs to understand the long-term side effects for head and neck cancer patients and how they can support those patients, particularly around oral care, and making sure that they have a good relationship with their dentist and stay on top of the oral health. When I was diagnosed, I just wanted to gather as much information as I could, but as we know, it's difficult to get that source of truth. And I think the GP can play a really important role in helping the patients find that and stopping them from going to Dr. Google.